perfect. There's nothing wrong. So we call it a behavioral issue, right? So we cannot find a kid with a perfect symptom of autism. It's impossible. They might have some, they might not have some. So what they have come up with, if they have a spectrum, that means some of the autism disorder. So you could have two different kids. This kid has some of the symptoms, this kid has some of the symptoms. Both won't have the exact same. Does that make sense, folks? So that's why sometimes people are disagree, some people agree, because there's no cut diagnostic features. Okay, this is what that autism means. This is what autism means, folks. Okay, so that's the idea. That's the autism spectrum disorder. Onset is early childhood, social and communication defects, and repetitive ritualized behavior. You know, sometimes they do the same behavior repeating, restricted interest, maybe accompanied by intellectual disability or above average. You know, some kids are super smart. Okay, they are super smart. More common in males, associated with increased head and brain size, folks. You know, it's pretty interesting. I've actually never seen an autistic female kid, actually. It's always boys, males, okay? So that's something. Next, just to give, the severe form is autism. The milder form is called Asperger's. You know, they even removed that. The mild form of autism, it used to be called Asperger's syndrome, folks, okay? That's that. Now, next, conduct disorder. What did we say about conduct disorder this morning? It's the exact same antisocial, but when you are less than 15, it's conduct disorder, isn't it, folks? Now you could see that here. That's the conduct disorder. After 18, you go for antisocial personality disorder, folks. Now, that's not the problem here. How do you differentiate conduct disorder from oppositional defiant disorder? It's very difficult. So what is oppositional defiant disorder? It's the pattern of anger and irritability with argumentative. So let's talk about this, folks. Oppositional defiant disorder, these people get mad and they argue with people. They always argue with authorities. They will argue with police. They will argue with teachers. They always argue, but they have no physical touch. They would not hit anybody or they would not damage properties or nothing. It's only verbal communication. Is everybody clear, folks? Oppositional defiant is only verbal. Look at this, argument with authority. Okay, so only verbal. I will write that, only verbal. What they do, they will talk so much to provocate the opposite person, and the opposite person will hit this person. And who gets arrested? Whoever hit first. Does that make sense, folks? So that's what this one is, okay? So that's oppositional defiant disorder. Now, when it comes to conduct disorder, it's not just verbal argument. They actually will hit people, damage property, do all those things, folks, okay? So conduct disorder is more severe than oppositional defiant. Is everybody clear, folks? All right. So that's that. Next, disruptive mood dysregulation disorder, right? This is onset of before age 10. These kids are severe recurrent temper outbursts out of proportion. So these kids will get mad all the time. You know, look, imagine a 10 or year younger, they get mad all the time, right? Child is constantly angry, irritable between outbursts, folks. They are mad. So that's that, folks, okay? So we have to do CBT, stimulants or antipsychotics to control. So that's the idea here, folks. Now, the problem is, you know, once you put those antipsychotics, it's a lifelong after that. These medications, you know, they just need to be sent to Asia. They need a factory resetting there. If you send them to Asia, they do a factory reset, all the problem will stop. You guys know what's factory resetting, right? A good slap on both sides cures everything, right? We call that factory resetting, right? That's what we get these things. You know, in my country, there is no ADHD. If a teacher tells you your kid doesn't listen in the school, only one treatment happens in the house, problem solved. Permanent cure for ADHD, right? Next day, we don't move. We are glued to the chair, right? Same thing with, you know, with anger, these things. One factory resetting, like a new software update, all things done, right? That's the idea, folks. Now here, and I mean, it's true, like, you know, that you cannot put a patient, I can't believe a less than 10-year-old kid taking antipsychotics, you see. It's sad, okay? So that's the idea, folks. Now, look at this one, intermittent explosive disorder. Onset after age 6, recurrent verbal or physical outbursts representing failure to control aggressive impulse. I've seen a kid actually once in a parking lot in a hospital, and the kid started punching the mother, actually, like a 7 or 8-year-old. I was just telling myself, if I would have done that to my mom back home, I would have burned alive that day. I would never come up. Like, not only hitting, I can't even say something. This is like these kids here. Oh my God, unbelievable. Okay, so that outburst lasts and out of proportion, that's the idea, folks. Okay, and it gives you legal, financial, or social consequences. That kid was throwing the iPad. I was worried. My car was parked next to it. I was like, you touch my car, I'll file a lawsuit. No, I'm kidding. I'll smack the kid. So the idea is that's, this outburst here, guys. Episodes are not premeditated and may provide an immediate sense of relief. Okay, that's the idea, folks. That's that. Now, next, intellectual disability, folks. Okay, intellectual disability is the new terminology for mental retardation, right? So that means it's a global cognitive defect. What is global cognitive defect? They cannot learn anything. They cannot adapt to anything. So basically, they are dependent on somebody else. They have to do everything, folks, okay? That affecting reasoning, memory, abstract thinking, judgment, language, learning, nothing. Adaptive functioning is impaired. That's what you should know. Okay, they need help. Leading to major difficulties with education, employment, nothing, folks, okay? So that's that. These kids need psychotherapy, occupational therapy, special education and stuff, okay? So that's intellectual disability. Now, I want to connect that with specific learning disorder. Okay. Now, specific learning disorder means these kids have difficulty learning a specific language. Just not language, my bad, specific subject. They cannot just do one subject, right? Look at that. Answer during school age years, inability to acquire or use information from a specific subject. Like, for example, I think I have a specific learning disorder because I cannot learn math. No matter how many teaching I go, the only thing I haven't tried is Kuman because, I'm too big to try that. But biology and science comes naturally. I don't even have to study. It will come automatically. See how they have categorized it? Every kid is good at some subject. Does that make sense, folks? So some people are not good. Some people cannot draw. So that means they are bad at drawing. If you go to psychiatrists, they will tell you a kid has specific learning disorder that he cannot learn drawing, right? That's the idea, folks. Okay. But everyone is. And I hope everybody here have no specific learning disorder in medicine. Okay. So you're studying for step 1. We better be good at it. Okay. Now, near age expectant, they're all good with other than that. General functioning, intelligence are normal. That's all it is, folks. Okay. That's the idea. What treatment? Academic support, counseling, extracurricular activities. That's why they say it's so important to identify your kids' talent. You need to figure out what your kids are good at and not good at. You cannot force your kid to learn something they are not good at it. Does that make sense, folks? We do, that mistakes happen. In the way I come from, we have only 3 options in an Asian background. You either become a doctor, engineer, or lawyer. There's no any other options. Nothing exists other than 3, right? These are the only 3 choices to pick. Okay. So, but there are so many other fields, right? So that's basically it is. And they get forced, right? All right. So that's that. Next, go here, selective mutism, folks. What is this? It happens before the age of 5. It happens, whoever has kids, you would know. You take your kid to somewhere, a new place, and the first time when you go, they are so quiet, they won't talk. Because it's a new place, they're a little nervous, right? But after a few weeks, they will control the whole place when you take them next time, right? So that's what this one is, folks, okay? It's an anxiety disorder lasting for more than a month involving refraining from speech in certain situations despite speaking in other areas. So they talk a lot somewhere else, but they don't talk, okay? Now, usually more comfortable situation, that's the idea here, folks, okay? But then they do. But in case if not, you have to do some play therapy and all these things, folks, okay? So that's the idea. So that's that. I go through this. When my daughter started going to school, the school teacher sent a note that my daughter doesn't speak a lot. They're like, you want to consider into it. I said, oh God, no, you have to come and see how they talk in the house. Right. And my second one is 5-year-old. And the other day she's telling the 7-year-old, she was like, my first one is called Maya. She's like, Maya, you know what happened when people get married? And I was like, they're talking 5 and 7-year-old. 5-year is telling the 7-year-old what happens when you get married. I was like, how the hell did you get learned? It's all YouTube. But when they go to school, they don't talk, right? You see how they get judged? So that's how it is. So they get used to it, folks, okay? Now, next, separation anxiety disorder, folks, okay? Overwhelming fear of separation from home or attachment figure lasting for about 4 weeks. The first time you take your kids to daycare, right? That's how their school lifestyle start, right? From daycare, they go to school. The first 3 weeks, it's a nightmare because the kid will scream the minute you open the car door because they don't want to go to daycare, right? But after 3 weeks, they want to go to daycare all the time because in the beginning, it's a separation anxiety disorder. It goes about 3 to 4 weeks, folks, okay? Can be a normal behavior up to age 3, 4. They will come up with all the symptoms. They don't want to go to school. They have abdominal pain, belly pain, toothache, all these things, so, okay? And I used to tell I have a bellyache that I don't want to go to school. And then my dad will say, let's do all the homework in the house. I was like, no, it's okay. I'll go to school because it's much better to go to school than dealing with my dad, So those are the excuses you do. That's separation anxiety disorder, folks. The last one we have here, Tourette syndrome. This happens onset before age 18. These kids have sudden, recurrent, non-rhythmic stereotype behavior. They will repeat the same word again, and it could be a bad word or anything. They will keep repeating and screaming. We call that coprolalia, the involuntary absent speech. They keep saying something, they will scream it, folks, okay? Found in some patients associated with OCD and ADHD together. And again, these are very rare. Most of the time, they don't even come to hospital. These kids goes to psychologist and behavioral therapist, okay? So that's this condition. These are all childhood and early onset disorders, folks. Let's go to the previous page. Now, child abuse. There are 3 types of abuse: physical abuse, sexual abuse, emotional abuse. All of them happens, okay? Because you guys don't know, you think it is not rare. Which one do you think is the most common out of 3? Take a guess. Take a wild guess. Okay. So now let's talk about physical abuse. These are non-accidental trauma that happens. So they bring the kids, you could see these are not trauma. So that's like physical abuse, folks. Caregivers may delay seeking medical attention or provide explanation that doesn't make sense. A good example I will give you. The mother will say, 4-month-old baby rolled down on the bed and fell on the floor. And until 6 months, they don't know how to roll over. Is that clear, folks? So those are the things because the parents don't know those things. They will tell you things don't make sense. 40% of death related to child abuse or neglect occur in children less than a year. Okay. Now, my wife has a special needs therapy center here. There's a true situation that I heard. So there was a twin baby. The one twin baby was on the crib. The other baby was on the floor. And the husband and wife started arguing. And they started fight. And the husband was wearing a huge boots shoe. And they started arguing. And all of a sudden, the husband lost it. And he jumped on that one baby on the floor. It was a 3 weeks old or 4 weeks old. And that baby's intestine and everything prolapsed right there and died on the spot. I mean, imagine in a 3 weeks old, somebody jumping with the boots. What do you expect? So that happened. And then he got mad and he took the other kid on the crib and threw it to the wall. So nothing happened to the life. So she hit her head. That's all it happened. And now when she grew up, when she's 2, 3 years old, she has a developmental delay because of that head injury. So that kid comes to her center. That's how I know this story. So father was given 26 years in prison for that. That's not enough. They need more than that. Instant death, right? I would be more than happy to cut their skin from their face while they are alive. With a neat dissection, I will do it. Okay. So the idea, I mean, that's what you have to give it, right? So at time I shouldn't be saying these things. I don't know why I'm saying. It's Friday. Okay. So that's the key here. I mean, it happened, right? Look at that kid now, the developmental delay. Every time I see that kid and I go there, it's sad, right? So that's the key for it. Happens a lot because we don't know that. You see, if my wife didn't tell me, I wouldn't even know about that, right? So there's so much happens every day, folks. Okay, there were so many injuries happens every day. And okay, next, sexual abuse. STI, UTI, genital, anal, or any other trauma, we have to think that most often there's no physical signs. That's a key. Sexual abuse should not be excluded from a differential diagnosis in any physical trauma with the kid, folks. Okay, that's, and also if the kid is showing too much about sexual knowledge or behavioral background with the age, you have to consider something. Okay, so that's that. Peak incident is 9 to 12 years old, folks. Okay, so that's that. Third one, emotional abuse. These are babies or young children may lack a bond with the caregiver, but are overly affectionate with less family adults because they are alone, lonely. That's a problem here, folks. Okay, they may be aggressive toward children, animal, or any unusually anxious. That's what the idea is. Older children are often emotionally labil and prone to angry outbursts. They may distance themselves from caregiver and other children. That's the key. Now, when it comes to emotional abuse, right, there's something called socioeconomic status. Have you heard that word? What is socioeconomic status defined as? Does it determine by money or education? Education. So when we tell, for example, this person is considered high socioeconomic status in the society, that means they have the highest education. So socioeconomic status is determined by education, folks. But the thing is, the higher the education you have, the better money comes with it. Is that clear, folks? That's it. Now, if somebody have no education, they could be billionaire, but they are not considered higher socioeconomic status. Is that clear, folks? That's what the definition. Okay, it's a biostatistics definition. Socioeconomic status. Education is, so technically, people with PhD, it's considered the highest socioeconomic status, not even doctors. Okay, so that's it. Now, emotional abuse, there was a research done, it's found on higher socioeconomic status family. Yeah, at those kids, because if you see those high-end education and thing, and what happens is, this is the truth, right? Most of the time, mom and dad, they both go to work, but they have very high professional jobs. Take a good example of doctors. Husband and wife goes to hospital, they make a good amount of money, they have a kid. They don't want to send their kid to daycare because they have money. What they do, they hire a nanny, private nanny to come and watch, right? I know it looks fancy, but the problem is the kid is not meeting another kids. Is that clear, folks? The kid has to meet the rest of the kids to learn. The kid grows together with the other kids, right? So they have to see, that's why all those kids are inside the house with the nanny. And then the kids doesn't know anybody other than nanny and the parents. Does that make sense, folks? And they don't see the outside world. They don't know what is group play. They don't know what is this one and stuff, That's what the emotional abuse comes from, all those things, right? Now, if you see the kids in a middle-class family or low-income family, they are actually smart. They know what the world is, right? Because they see many people and do that. That's why I always tell every doctor, whoever I know, send the kids to daycare or school or somewhere. Don't just keep them in the house. They were like the daycare, it's in kids get sick and everywhere you get infection. What's a big deal? Your kid is not made up of gold, right? If you get an infection, you give antibiotic, right? I mean, and in a way, they are exposed to more antibodies, and then they will create more energy. When I was a kid, right, we leave the house and we come back only in the night after playing all the dirt and every single crap you can see, right? I have no problem. I could eat any food anywhere. No diarrhea, nothing. Healthy. That's what it is, because we have antibody for everything, folks. That's exactly, on Fridays, you guys won't believe it. Usually Friday lunch, do you guys have Home Depot Menards in your state, I assume? In front of that, there's a taco truck, okay? That truck has the most tastiest taco you could get it. but you have to stay on the road and eat, basically. It's like a cart food. That's where I go eat actually mostly on Fridays, because that taco is so tasty, authentic taco. It's not like westernized in a proper restaurant. I like that. And then my wife is like, ew. And I was like, what do you ew? It's a good food, right? She's like, you're going to have diarrhea. I was like, I bet you nothing happens next day. Because why? Our body has immune system for it, right? I could eat there. I could eat in a 7-star hotel. Nothing happens, right? You have to let the kids to expose to those things, folks, right? That's important. So that's where the emotional abuse also comes, okay? So now if you see, 80% of young adult victim of child emotional abuse meet the criteria for one psychiatric condition. 80%, that means 8 kids out of 10. That's sad. Is that clear, folks? So that's very important, okay? Now, that's child abuse. Now let's see what is child neglect. When it comes to neglect, it's failure to provide food, shelter, supervision, education, and affection. It's sad. Like, for example, I know only about state of Illinois. If you have low income and you have a kid, let's say you contact the state, they will give you a house, not even an apartment. They give you a townhouse if you have a kid. They pay for clothes, food, and daycare, everything. And they will provide you food, everything. So you cannot say we are not providing a product. What these people do, they take their townhome and they sublease to other people. Okay, a lot of those things happen and they are neglecting, right? That's the most common form of child maltreatment, poor hygiene, malnutrition, and all these things. This is, as with child abuse, suspected child neglect must be reported to what we call DCFS, okay, Department of Children and Child Affairs. You have to, right? That's very important, folks. That's child neglect. The child is being neglected, folks, okay? So that's the idea. Next, vulnerable child syndrome. So what does that mean? Parent perceive the child as especially susceptible to illness or injury. See, what happens is, let's say a kid get one bad infection at a young age. After that one infection, we are scared in the future and we spoon feed the kid for every little thing. We don't let them go out because we are scared. That's what we call vulnerable child syndrome, right? So, usually follows by serious illness and life-threatening events. Something happened wrong first time. Now we don't let the kid to do anything after that. That's not supposed to be, okay? Can result in missed call, all these things, folks. Even a little symptom, they will be at the ER door, right? So that's vulnerable child syndrome, folks, okay? That's the idea. Now, that's child neglect. All right, let's go here. Let's go to this page. Let's do orientation. Now, when we say a person is oriented ×3, that's how you write the patient note. That means you're oriented to time, place, and person, okay? So when we say we are disoriented, that means we are not oriented to one of those 3. Most common cause, of course, alcohol, but the most commonly it's due to fluid and electrolyte imbalance, folks, okay? Like sometimes you notice that if you haven't eaten a whole day and you can't even remember a simple phone number because it's hard to recall it. It's just for a few minutes, then the number comes back, right? That's a fluid and electrolyte imbalance, and that's the idea, judgmental, okay? And hypoglycemia, look at that. That's what happened when you don't eat, had trauma, any nutritional deficiency. All these are called orientation, folks, okay? Now, there's a 2 types of amnesia, retrograde amnesia and anterograde amnesia, folks. Retrograde means inability to remember things that occurred before the CNS insult. Anterograde means inability to remember things that occurred after that. Now, see, that's something you have to be careful. Okay, let's do it the time, man. So let's say, I'll give you an example. So somebody got into an injury. So let's say some car accident on a Monday. Okay, no, I'm going to make it Wednesday, okay. Wednesday, someone got into a car accident, got a hit on the head, okay. Now, this person will recover on Friday 100%, 100% recovered. So on Friday, the person recovered completely. Is that clear, folks? Now, If I ask the person and the person don't remember anything that happened from Wednesday to Friday, so the person don't know Thursday what happened. Is everybody clear, folks? That is called anterograde amnesia. So that means on Friday, you are like, oh, I don't know. I remember getting into an accident, but I don't know what happened afterward until just now. Is that clear, folks? So that's anterograde, okay? So they will tell you nicely, yeah, I remember getting into an accident, but I don't remember how I got into the hospital. I don't remember how I recovered. That's anterograde. Is that clear, folks? So on Friday, they know something. But if it is retrograde, mean basically they don't remember what happened on Tuesday, right before the injury, folks. They will tell you, I don't even remember getting into an accident. Is that clear, folks? That's the retrograde. Both can happen during anything, and it goes away, folks. They feel better. Sometimes they don't, sometimes they do. Okay, so that's retrograde and anterograde. Next, this we will talk in the neurology. It's Wernicke-Korsakoff. We have to do some anatomical structure, so let's not worry about that, folks. Okay, now let's go here. Now, first one. Depersonalization disorder, folks, okay? These are persistent feeling of detachment from its own body, thoughts, and perception and actions. This is little crazy disease. So they think I am different from my body. So my spirit is just using this body to live, but they are different, two different things they think. You see, even when I'm explaining, sounds weird, isn't it, folks? That's what this disease is, folks, okay? This is the different one. Now, intact reality testing versus psychosis, but they just believe that every human is two. There is another person inside, it's just the body outside. They are separating their own soul with the body. Is that clear, folks? So that's that. Next, dissociative amnesia. The good example is dissociative fugue. You know, I always tell the example, that movie, Bourne Ultimatum. Have you guys seen that movie? What is that Bourne Ultimatum movie about, right? The movie's there's a couple of episodes. First one was in Paris, and the second one, I think, was in India. They took it, right? What happens is, folks, unable to recall important personal information following a severe trauma. So what happens in that movie, the guy get into a severe trauma, and all of a sudden he end up in Paris, but he doesn't know how he ended up from US to Paris, and he doesn't remember anything. He won't even know his name. Nothing they could recall. Okay, nothing. So usually what happened in that disease, unexpected traveling away from home. That's why in that movie, he's from US, but he's end up in Paris in Europe. Does that make sense, folks? He doesn't know how he end up in there. He won't remember his name, his profession, nothing. Okay, so that's the movie they took, because of this dissociative. Second episode, he end up in India. That's even further, you see. That's the idea they use it, folks, okay? Now the last one, multiple personality disorder. When we call multiple personality disorder, the person has more than two personalities. One doesn't know the other one, folks. Okay, that's the idea. So some people can have two, some people can have three, some people can have 10. You don't know that, okay? Typically with distinct memories and pattern of behavior, more common in females, associated with history of sexual abuse, PTSD, depression. So what they say for multiple personality disorder, there's a very strong stress or PTSD, something very strong in their mind. That's what that creates that, folks, okay? So remember, one personality won't know the other personality. They don't know both, okay? So that's that. Last part, delirium. When we talk about delirium, folks, it's a waxing and waning level of consciousness. Delirium is a complication of another existing disease. Think as ARDS. That's the best way to think. Nobody developed delirium as a primary disease. So if somebody tell me I have a patient with delirium, my question will be, so what primary disease does the patient have? Some disease have to be, okay? Now, look at this, usually secondary to other identifiable illness. The most common that we see a lot is infection, folks. Infection that gives you metabolic or electrolyte disturbances. This is pretty serious and severe, sad story. When people get, I'll tell you a true story, this happened. This old lady, it's always happening in elderly people. Okay. Now, let's say elderly people getting this lady, 70-year-old, they brought her to the hospital by their family, son and daughter-in-law. Symptom was, I heard my mom is randomly talking, and she's talking when there's no one, and she's seeing things and stuff. That's why they brought her to the hospital. So you would think right away, this is a neurological case, isn't it, folks? Now we admit her and we do all the work, and we find out simply she had a UTI. That UTI caused delirium. Okay, a simple UTI causes delirium. Remember, elderly people lose the sensation, so they might have UTI, but they won't have any standard symptom of UTI. So by the time they come now, this person have delirium. Is that clear, folks? 99% of the time, they die on the 4th day after we diagnose. They don't, that's a sad part, because delirium is the last manifestation of complications. So that means there must have been a good 10 days between the UTI and the delirium. So by the time they bring her to the hospital, it's too late. Is that clear, folks? So that's how it is. I've seen few cases. Now I have that peace at mind. If I see an old lady with delirium, and I have a feeling that, oh, she's going to die in 3 or 4 days, because they come too late. Elderly people are very sensitive to fluid and electrolytes. Is that clear, folks? So that's the key here, okay? Now you can see with the decreased onset of attention, decreased level of arousal characterized by disorganized thinking, hallucination, misperception. That's what the family identifies. They bring them for that. They don't identify the underlying problem. Does that make sense? So that's the idea here, folks, okay? It says early onset is reversible, but by the time they come, it's too late, because that's the only time they bring it, folks. Okay, so that's a sad part. Most common presentation of altered mental status in inpatient setting, especially in the ICU. That's even worse. Look at the treatment, identification and management of the underlying condition, because there is no treatment for delirium. You have to cure the underlying. It's like ARDS. You could give oxygenation, but you have to treat the underlying cause for the ARDS to get better. So everybody clear, folks? So that's your delirium. Okay, we'll talk about medication later. So I'm going to stop here. So we're almost done with psych, and we have a little bit, and then pharmacology. So we're going to finish that on Monday and start musculoskeletal. Okay. So we should be able to finish musculoskeletal on Tuesday, and Wednesday, Thursday, Friday, neurology. I'm keeping that for last. Okay, and then genetics, of course. So that's the idea. So what I would recommend this weekend, review what we have done this week. We did quite a bit. I would review renal one more time, and psych is easy sometimes. So you don't need to worry too much. Today, if you review, you are good, and take a good rest, because we have only one more week. Next week is going to be even difficult. Okay, it's a 6-week energy. You guys are paying attention. That's a good sign that you are keeping their attention. But next week is even harder. So get a good rest, and then I'll see you guys on Monday.
Thank God my fasting, Anders.
You said you are done.